Vamos a arrancar con la primera ponencia del día. Quiero recuperar una pregunta que nos dejó sobre la mesa Lluís Santís, de Aptronic, ayer en la primera ponencia, que fue fascinante, la de inteligencia artificial y robótica. ¿Se acuerdan que nos dijo, hay que estar muy atentos a qué país es el próximo Taiwán? El próximo Taiwán en cuanto a semiconductores, en cuanto a fabricación de chips, poniendo de relevancia que tendría que ser un país europeo, que ojalá sea una región europea, que ojalá sea Barcelona, Cataluña o que sea algún lugar en España. Yo me quedé con esa clave, porque él, que nos visitaba desde el Silicon Valley, pues lo dijo como una aspiración a la que tenemos que llegar. Bien, pues hoy arrancamos hablando de un sector en el que sí podemos presumir de convertirnos en ese Taiwán, pero en este caso de la biotecnología, o el Silicon Valley, en este caso, de la biotecnología. Estamos hablando de que Europa es una región puntera que lidera o aspira a liderar en este sector y que Barcelona, en concreto, puede convertirse, aspira y tiene muchos números para ser esa capital científica y biomédica. Tenemos hospitales de referencia, centros de investigación, startups. ¿Qué falta? El salto de escala. Financiación privada, que en estos momentos todavía es insuficiente. ¿Qué ocurre? Hay empresas europeas que sí nacen, crecen y ofrecen apuestas muy importantes, pero se venden antes de convertirse en grandes empresas. Y nos falta también un marco regulatorio común, no más normas, sino simplemente que sean comunes, fáciles y entendibles. Porque sí, vamos con el título de la mesa, la próxima gran industria europea empieza en un laboratorio. Vamos a asistir a una interesantísima mesa redonda a cargo de Laura Colón, presidenta de AstraZeneca España, Carolina Aguilar, CEO de InBrain Neuroelectronics y Tim Notiris, CEO de Agomab Therapeutics. Modera Clara Campàs, vocal de la Junta Directiva del Cercle de Economía. Bienvenidos. Esta sesión se conducirá en inglés. Recuerden que tienen a su disposición los traductores. Adelante, Clara.
Muchas gracias. Bon dia, buenos días. Probablement aquesta indústria comença en un laboratori, però no necessàriament hi acaba. I aquí està una mica el tema del que voldrem parlar avui també. So we're saying that it's true that the title of the session is that this new industry starts in a lab, but not necessarily finishes there. I mean, we need to make sure that this runs beyond that, right? So the Draghi report, as we have been saying during these days, and other reports in the last years, identify health and biotechnology and everything related to health innovation as one of the key sectors where Europe can still be a global leader. And it does not only have to do with knowledge, it has to do also with industry and with regulation, as Veronica was saying, and to make sure that we have an ecosystem that integrates everything for this sector to become a true sector and motor of the economic European institution. And Barcelona, we will speak about that too, is a well-known hub in this industry, and the three companies we have here today represented also have links to that in one way or another. But the European sector on the biotech and health innovation has not yet led to scale. So scale is what we are missing to become really true global leaders from the citizens' perspective, from the countries and territories' perspective, but also from the companies' perspective. So today we'll have the opportunity to speak about some of these topics, and please, questions are welcomed. I will have here, I will be receiving your questions, so I hope we'll have time for that too. And we'll have also the opportunity to learn a little bit more about what these companies here are doing and where they are doing that in a global manner. So, buenos días, good morning. I will start with Carola. Your company, InBrain Neuroelectronics, is developing devices made of graphene for brain-computer interfaces, but to be used mainly in medical uses. Two questions for you, Carola. What is your company really doing? Because that might sound a bit weird when I say brain interfaces. And why are you headquartered in Barcelona?
Yeah. So the neural system is the body's operating system. When it fails, life also fails. And therefore, we are creating a next generation of autonomous therapeutics. It's an implant on the brain that can read and write neural signals in very high resolution and restore functions that are lost in the body, both at the central nervous system level, so Parkinson's disease, fixing Parkinson's disease without drugs or with much less number of drugs, but also diseases on the cardiometabolic space, so in the peripheral nervous system, such as rheumatoid arthritis, in the future obesity and others. So it's a smart system that can diagnose and treat real time in an autonomous way and adapting to the environment of the patient.
Why headquartered in Barcelona?
We headquartered in Barcelona, first of all, because I think there was a pioneer vision from Barcelona to participate already on a project called Graphene Flagship when the Nobel Prize of Graphene was given in Manchester. The European Union and the Nanoscience and Nanotechnology Institute of Catalonia had the vision to actually be part of that. And that €1 billion was to translate graphene to commercial products. And we found the technology here, we found the talent here, and we thought that it was a great place to attract talent globally and compete globally.
Good, super. In fact, your co-founder, Jose Garrido, is one of the CRIA investigators. I think someone born in Cordoba that had grown up professionally worldwide and then came back to Spain and to Barcelona, thanks also to the ICRIA programs.
ICRIA, I think, is part of the vision. Congratulations to this region for having created that program, because we attracted a second ICRIA professor recently, and it wouldn't be possible without that program, which has attracted many other talents.
Yeah, thanks. So Laura, on a different setup, AstraZeneca is a global pharmaceutical company. You have headquarters in both the UK and Sweden, and the company is listed in the London Stock Exchange, but also in NASDAQ.
Mm-hmm.
How does a global company operate in a global manner to ensure distribution across the territories, and what are your angles? We will leave the Barcelona piece of it for the very end. So how do you operate in these regards, and what are your presence in the different territories? What is AstraZeneca really doing in Europe?
Mm-hmm. Okay, first of all, thank you very much for inviting us today here. Let me give you an inch of what AstraZeneca is to give to you and the audience that I mentioned. We are a 25-year-old biopharmaceutical company. We are settled in 25 countries, and up to date we are a little bit more than 95,000 employees. From the revenue perspective, last year we declared $59 billion, and we have committed to become $80 billion by 2030. The way that we do that is through our portfolio and mostly through our pipeline, so the innovation that we are going to deliver into the market. We have committed 20 new medical entities. We have already delivered 9, so we are really on the path and very excited about that. The way we are organized and we deliver that innovation is in 5 different therapeutic areas. We work in oncology, in the cardiovascular and metabolic diseases, in the respiratory and inflammatory diseases, infectious and rare diseases. So we are covering all the big spectrum of the big unmet needs. So to your question in operations, we have a diverse strategy on how do we operate across the world. We have 30 sites on manufacturing and production across 16 countries across the globe. And from the R&D perspective, that is also something we are going to discuss during this panel, we have 10 strategic centers across the world, US, China, and Europe. And Europe is very important for us. Actually, we are very proud, and I'm super excited that the company decided to invest here in Barcelona, where we have our global hub in Barcelona that I will explain a little bit later. So definitely, to the question on the title of the panel, we are really interested in to keep investing in Europe, though there are areas in competitiveness that as Europeans we need to tackle and to accelerate, like the times of investment. How do we invest in funding for innovation and all of kind of things that I think we have time to discuss later.
Sure. It's interesting because sometimes I think citizens might think that global companies usually invent in the US, manufacture in China, India, other territories, and end selling in Europe and doing a little bit of consultancy in Europe, right? And that's not really the case, and we were preparing this pen, and let's how to ensure distribution of products, in this case of drugs, is a key topic in this regard. Thank you. Team, AgoMap. AgoMap is developing, correct me if I'm wrong, novel drugs for the treatment of fibrosis in different tissues. We will talk later about funding, but you are headquartered in Belgium. But I think when I speak about AgoMap, I like saying that this is a pan-European company somehow, operations-wise, while you already have presence in the US. So how are your operations distributed in this regard, being a discovery company at this point?
Yeah, and thanks so much for having me in the first place, Clara. I mean, a brilliant event, and I probably need to apologize. I'm probably the one reason why we do this session in English.
That's okay.
I was just joining another panel that was in Catalan, so I was a little worried that I will have to upgrade my language skills towards the local language here, but thanks so much again for having me. Yeah, so, pan-European company. We see ourselves as a global company, obviously. I think in drug development, everything you do is on a worldwide scale. So we have offices indeed headquartered in Belgium, so Europe, research facilities in Galicia, so in your beautiful country, but we have US offices as well these days. And the way we are set up is to really make sure that we build skill in Europe. And one of the key reasons why we wanted to do that is because there's an abundance of talent around here. And unfortunately, there's not a lot of successful growth companies. So not only are we very well able to recruit the very best of talent across various European countries, not just Belgium, but more generally, but we can also really retain the best talents at typically a lower cost level than our US peers. And I think that gives us a massive competitive advantage. So absolutely, based in Belgium, in Spain, and in the US as well, and we operate worldwide.
Good, thanks. So let's move a little bit from operations to investment and funding. So as you all know, bringing a new medicinal product into the market requires capital, or if I can say it that way, smart capital, patience, because it requires some time, through a regulated path, and also enhances technical risk. So this capital is not viewed for sure into something that will finally reach the market, right? So it entitles certain properties of how this funding needs to be done. So the classical journey of European biotech, either in Barcelona or in other places in Europe, and probably also in the US, will be to start being funded by small capital, so I don't know, business angels, things like that, and then venture capitals that are syndicating and joining efforts to start funding more and more those assets, those companies. And finally, those biotech companies or startups can become scale-ups, and here we have a little bit of a gap that we will discuss. And also non-dilutive funding, mainly in Europe, in form of grants, public grants. In the US, it's more patient associations grants or similar things. And then when those companies want to raise more money in subsequent funding rounds, they need to do for IPO, or they are acquired, or the fact that they are acquired is not necessarily something bad, as far as we can maintain some kind of operations and not deindustrialize the territory if these are European companies. So Team AgoMap was initially funded, as I was just saying, right, by European and other non-European VCs. Then the rounds become bigger while you were developing those assets into clinical trials and becoming a bit more mature. And you finally IPO'd the company into NASDAQ in February 2026 this year. And today I have managed myself to not look at the price of the share 3 times or 5 times a day, but only one, which is good. And how has this journey been done by AgoMap, and how would that be different if the company had not been headquartered in Belgium, but in the US or in any other place?
Yeah, very relevant question, although I think the answer is, of course, case by case. The way how we build it is indeed we did the seed and the Series A purely European. So we raised a little over 20 million in 2019, I believe. But for the B round already, we went to the US. We brought on board the crossovers, because what's really important, at least in my vision, is that you always bring investors that can also lead the next round. So not just looking at the current needs, but also always having an eye on the future. And with the B round, bringing in US investors, we knew we can actually secure support for the C round. And then with the C round, we even brought on board some of even the larger US funds, like Fidelity, which are then instrumental, of course, to, in the end, make a step towards public markets, which we successfully did earlier this year. Is that different from US companies? Maybe if you look at the size of the rounds, it's typically somewhat smaller in Europe. But there's also a very different level of ambition, I think. So instead of just putting the blame on investors that may not be large enough or maybe too risk averse, at least perceived too risk averse in Europe, I think it's incredibly important to also look at the ambition levels of the entrepreneurial teams, the executives teams. But focusing the question on finance, I think perhaps there's 3 grounds whereby Europe, more generally speaking, we're struggling a little bit. I think it's in early stage funding, so the Series C, the Series A, maybe the Series B, because some of the funds up to about 500 million in the life science are struggling these days to raise additional cash. There's always the positive exceptions like yourselves, Clara, for very good reasons. But generally speaking, these funds are struggling. So there's less cash available for early stage science. We really lack more of these growth funds. So once you have gone through hundreds of millions of rounds, you want to be able to also stay private a little longer. And I think there the US funds are typically much, much larger and more long-term oriented than the European funds. And obviously, we lack public capital markets in Europe. We have those, but it's not at the same level and the same depth and understanding of at least the life sciences. So most of the companies like ourselves, we then decide to go to Nasdaq. So early stage financing, growth financing, and of course capital markets. I think that's where we probably need to focus in the years to come.
Thanks. Quick question. How did you convince Fidelity, a big US investor, to invest in a European company or assets? What were the key things that convinced you?
Obviously, Fidelity are the type of funds that only want to invest in big cases. And I think we always ask ourselves the question, what if we are right? So we do incredibly risky science, but what if we are right? What if these clinical trials read out successfully? And then it needs to be really game-changing. It needs to be transformational for the patients. And I think that's exactly what we're doing. We're working on Crohn's disease, whereby half of these patients have developed into a more fibrotic state of disease that cannot be treated with the current standard of care. So what we're trying to do is to really help these particular patients. If we are successful, and I'm not saying that we will, because for that we run the trials, but if we will be successful, that will be game-changing. And I think that's the type of massive, ambitious science that some of these larger funds tend to support.
Thank you. Thanks, Tim. Carola, InBrain has been compared to another company in the US, which is named Neuralink. And Neuralink was funded by Elon Musk and all the ecosystem there, right? There was an article in a paper a couple of years or 3 years ago saying InBrain is the European or the Spanish Neuralink in this regard. InBrain is considered a deep tech company, and we can have a bit of the debate here how much biotech is considered or not, but in this case it's clearly deep tech. And you are using materials and technology that are different from the Neuralink ones, and probably one of the differentiated key points. But of course Neuralink is in an ecosystem and with some names, even in with investors coming also from big technological players. How are you competing with that from the technological perspective and the storytelling perspective?
So first of all, deep tech are deep technologies, frontier technologies that redefine the next 50 years. So they are a little bit more complex, but they have the potential to transform a complete category. And this is where we play. Elon Musk with Neuralink, it's also a deep tech company, meaning it's semiconductor technology. It brings advanced packaging on chips, and it brings AI to actually read those signals and transform them into a benefit for the patient. However, the secret sauce that we are bringing on top of our architecture is graphene as an advanced material. The technology of Elon Musk and that many players on the brain-computer interface side is metal technology. meaning it's technology that can read very effectively, but it's very difficult for them to write at micrometric sizes. And writing on the nervous system creates a therapy. The reading part is just diagnosis, and when transferred to a computer, it serves as a means of communication, moving a cursor, moving a robotic arm, but it's not actually interfering into the nervous system and repair a function that has been lost. Graphene gives us that superpower, meaning we can read and we can write bidirectionally in real time, in high resolution, thanks to the combination of the material, also the chips, and the AI that process this information in high resolution in real time and in an autonomous way. So we believe that even if Neuralink has invested $1 billion at a $9 billion valuation, we have raised $130 million, but we have the superpower, not only the architecture and the material, but I think the talent and the support of the Catalan government, the Spanish government, and the European Union. So I'm very confident we can become the next billion company, Siemens, or one of those Philips competitors that displays technologies that the Neuralink want.
In this sense, and you were referring to deep tech, the Ministry of Science in Spain has very recently launched the deep tech initiatives. How can this impact INBRAIN in this
This
regard?
is of crucial importance. Why? The US government has put neurotechnology at the front of their strategic plan. China has put neurotechnology and BCI at the same level of autonomous vehicles and solar power. If we don't do what we are doing now in Europe, so putting deep tech as a sovereign technology, and hopefully neurotech, because this comes together, it's going to be difficult to be on that race because of the capitalization, the government support. So I think that not only the deep tech strategy, but the investment on the InnoFab project that the Generalitat, the Spanish government, and the European Union are running, they are fundamental pillars for us to scale at the same level of ambition of these two regions and these competitors.
And how is that related to industrialization? Because probably those new materials have to be manufactured somewhere, put together the different pieces. How do you envisage that?
Yeah. Well, the deep tech strategy brings what I call shifting a little bit from the art of research to the D of development and build the industrial tissue that we need to grow from. And I give you an example. We are now building in 1,000 square meter clean room in PCB, which, by the way, was built by Qiagen when the pandemic came, and they had to create PCRs at a higher speed. From that industrial tissue, now we are building this more advanced semiconductors fab that it's key for this upgrade of the technology, but also of our leadership in the region. So I think industrial tissue, it is the foundation to create a new pillar and the next industrial revolution.
Good news in this regard. Talking about operations, but also industry in this regard and how we fund it in the global manner. Laura, since Donald Trump's second inauguration in January 2025, and I have not brought here the slide, but I can briefly explain that to you. So if you take a look to the numbers of the investment that the top 20 pharmas have done in the US and in other territories in the last years, 10 years, you will see that those 20 pharmas have almost not invested in the US in terms of manufacturing plants or renovating those manufacturing plants until January 2025. And then all suddenly, from January 25 till today, those top 20 pharmas have invested more than $700 billion into the US territory for those manufacturing, which is not bad per se, of course, not for the US. And I think that whether this results in a continuous investment or whether this makes the US territory more competitive from the R&D perspective or not, this will be seen, right? We don't know yet. But it definitely alerts Europe that we need to do something to make sure that you continue and increase the amount of investment from these top 20 farmers and other farmers to the US territory. So Laura, we need to react, we need to attract more investment here. What can we do?
So that's for me is the core of the discussion we have today. The loss of competitiveness in Europe versus other regions. You mentioned US, but also it's happening in China. So, but today, for example, we are living longer and better than ever. We have increased our longevity. Europeans, they have passed 80 years old. In Spain, we live even longer, 84 years old. And actually, 70% of this increase is coming for the new treatments, for the new drugs. So we need to secure that our governments recognize the value of the innovation beyond the costs. Because without health, you do not have economy, you don't have sustainability, you don't have anything. So basically, we need to secure that they understand this is not only costs, this is investment in health. That's the first thing. Second thing, funding for innovation. And this is like a big debate on how much should we pay for the treatments and how much should we pay for the investment. So just an example, in US, they are investing 0.8 per capita on treatments, while in Europe, we are investing 0.3%. In Spain, though, we are better. We are at 0.5%, but it's not good enough. So we are still need to increase this recognition of the value of the new drugs. The third point here is the investments in R&D. 20 years ago, Europe was the #1 in R&D investments. As an Europeans, we have the commitment to invest 3% of our GDP in R&D. We have been stagnated in 2.2 for many years. And when we see the investments in US is above 3%, 3.3%, in China is 2.8%. So we need to accelerate and commit into the R&D and investments. And the third area, and yesterday the president of CAISA was mentioning very clear, we are like really good in regulation. I mean, we are over-regulating, but what happens with this is we lose competitiveness. Another examples, you will all understand how much it takes to put in place a clinical trial. On average, in US and in China, this is 60 days. In Europe, we have on average 110 days just for Europe, and then on top of that, you have the local additional regulation. So that means that it takes us as Europeans double the time to put in place a clinical trial versus US and China. So basically, but it's true that we are seeing from Europe the appetite, and they are moving forward. We are seeing the Biotech Act, we are seeing the new pharma law, and they are tackling these aspects that we are mentioning. Though from our perspective, and this is AstraZeneca point of view, when we are thinking that we need to improve these, let's say, competitive in timelines from the regulatory and clinical trials perspective, we do not agree that 75 days, for example, is good enough. Yeah. That's not competitive. We need to go for 60 days or below. That's when we truly compete. So I think like we are a dynamic sector that are bringing innovation into the market, and it's a responsibility to secure that our regulation follows the same speed and pace as the innovation, because at the end, the last goal is for this to come into the patients. And we are saying that it's taking way too long.
And you were referring to the Biotech Act. I think that the message here is we need not only to make sure that these Biotech Acts or other acts that are being led by and put on the table by the European administrations that are, I would say, ambitious enough in their starting point, right? Not only that we are making them happen at a real speed, but also that are competitive enough. You were referring to clinical trials. What about market access in these regards? Because I think that it's sometimes people think that companies put products in the market first in the US before than other territories. But that's probably not the case. It's about how does the thing evolved until that concrete novel product reaches the patient, right? Which is the definitely final goal of it.
So from the positive side, and just coming back in a second to the clinical trials, because that's one of the main reasons in Europe we are so good, and Mr. Draghi report, we can be the best ones among the different industries. In Spain, we are a strong talent, and we are the leaders in the clinical trials in Europe and across the world. First in Europe, and probably third in the world. Why? Because we have the best scientists, the best professionals, the infrastructure, the ecosystem is perfect, and something that we have different in Spain from the rest of the Europeans are our patients. The level of commitment, of generosity we are seeing here, it's outstanding. We are also seeing in the vaccine rates, in COVID and other vaccine rates, we are among the best in the world. So we have those patients that really commit jumping into the clinical trial. So from the research point of view, this country is a true critical pillar for the research in the world. Now moving into access, and this is a different beast. Yeah. To put some numbers in the place, the European Union, Europe, has recommended that since we have the approval from the regulatory bodies until the patient has access, it should be 180 days. What we are seeing is that in Germany, they are around 60 days-ish. In Spain, we are 537 days. That's the period of time until we get the approval, until we get access to our patients. That's for national. Then on top, we have some extra time from the communities. It's true that for oncology, it's even worse than that. So let me give you an example, and all audience can easily understand. If you're a patient and you have cancer, and you are in a metastatic setting, so I mean latest stage of the disease, you know that there is an alternative that is coming, it's approved, and because now information flies, thanks God, and you know that it's there. Your physician knows that it's there. But if you have a type of cancer that is very aggressive, you need to wait 2 years to receive this treatment, this alternative. That means that that patient will not get it.
I don't make it.
And that is unacceptable. Yeah. So, on the other hand, I mean, to be totally fair, Clara, we see that the governments are really trying to improve this. Biotech Act is really reinforcing this. Our national governments are truly trying to improve this, but the current reality is our patients are receiving the treatments way too late.
That's one of the main goals of our industry, right? So just to make sure that those novel products reaches patients and that they do that in a safe and efficient way, but also in the needed speed that we need to put at that. Staying a little bit on the clinical trial setting, we have seen China putting together some rules and incentives for global companies and biotechs all across the world to go to China to conduct their clinical trials. They have been managing to do things at speed with enough quality and with a lot of economic incentives. And at the end of the day, when a company wants to make a decision on where will I conduct studies, clinical studies that are pretty expensive, and no one is going to develop a drug to develop and to commercialize it only in a concrete, I don't know, the German market or the Italian market or any other markets. When you develop a new drug, a new medical device, you do that thinking globally, right? You want to put that product in the global market. So you need to go to each of the territories. And China is really putting lots of efforts to make sure that people go first, or at least very soon, to China to conduct clinical trials. So question to both Tim and Carola, and you answer in how you want, but what are your plans and where are you conducting your clinical trials today? Why are you conducting the clinical trials in this or this other region, and what are your plans in this regard?
Want to go first?
I don't think it's not longer about innovation, but a speed of innovation for many reasons, because of the catalyzing and the convergence of more finance, more capabilities, more options. So, well, in our case, we chose Europe first. So we had our walls first in human in Manchester, but very soon we are in the US. We got FDA breakthrough designation because there is this breakthrough path. By the way, we have applied to the first version of the European breakthrough path. Let's see how that goes. And we are exploring China as well, although we want to be Europe first for the world, if Europe is willing to do that, right? So, but I have to say, look, I was 13 years in Medtronic, the biggest medtech in the world, and we were always first in Europe, always, for the devices, for epilepsy as an indication, for obsessive compulsive disorder. So I'm very hopeful that we are going to get that speed of innovation back, because at the end there's lives waiting for us to act.
Yeah, great. Team.
Yeah, let me give a little more positive spin here. I think we have a tendency, of course, in Europe to start complaining about everything, that it takes long and the governments are not working with us. I think it's still an amazing place to run so many operations, including clinical trials. Yes, we run our trials globally, so we just completed a phase 2 trial, which we ran in the US and Canada and 6 European countries. We're going to move into a phase 2B, and again, it's going to be a worldwide trial. For the second compound, we're going to run a European trial. Why? Because it's really important to have a diversity of patients as well. And among different countries, we have a large diversity pool with different background treatments as well. That's important. And also the regulators are typically very supportive of that. Yes, we're dealing with somewhat lengthy approval processes, and still I would love to run the trials in Europe. The key advantage that European trial conducts typically has over US conducts is the speed, actually. The recruitment is typically much larger in European trials. And yes, we're also looking at China, and of course we're running part of US sites, but it's really important to actually also continue to do that in Europe. And so far that's always been the case. Europe is really well known for running these early phase 1 trials. And I think we have a number of very, very effective phase 1 units. Clara, you know firsthand, of course, we acquired your portfolio company.
Yeah.
That was at the brink of starting a phase 1 trial. So also there we ran the phase 1 trial in Spain. And there's no regrets we did that, actually. It allowed us to actually do a few additional measurements in patients, which had really helped us to better understanding the mode of action. So let's take a positive look at that as well. There's still so much to offer from a European perspective.
Totally agree. I think that conducting early stage clinical trials had to do also with what Laura was saying about the generosity of MDs and all the medical population, and also the citizens and the patients that really understand that this is what we need to bring innovation into the market. Thank you for that. So let's move a bit closer and stay on the positive tone on the Barcelona, right? So and the three of you have different angles and things related to Barcelona. So give me a minute to give you some data, right? So Barcelona has emerged as one of the most dynamic European life sciences hub. That's clear. I think that's well seen everywhere in many different industry reports. The biomedical sector represents today 7.6% of the GDP of the Catalan area, employs more than 7,500,000 people, and there are companies, more than 1,600 companies somehow related to the biomedical industry, from big biopharmaceutical companies into small startups or scale-ups. Some of the global pharmaceutical players are choosing Barcelona as a place to be for hubs, and not only for commercial or clinical research teams, also for hubs of innovation and R&D related to novel technologies, supercomputing, and many other things. And on top of that, we have also companies manufacturing and with real roots in our area in these regards. So briefly, because we are running out of time, Carola, what are the advantages and challenges of being in Barcelona and having your headquarters here?
Yeah, so I found the visionary people that believe on us and support us in the investment side, Asavis, Alta. I found the technology and the talent, so the ICN2 and my co-founders. I found that the government and the infrastructure was ready. There was hunger to actually compete and do it at the highest ambition. And I think it's a place where you can easily attract talent from all over the world. We are 120 people, more than 30 nationalities. We brought them from wherever they were, the best of the best, and we are ready. We are ready to keep the hot BCI race.
Good. Tim, Some of your programs, you discussed that already, were started in Spain and then progressed into this pan-European and global company that Agomap is. What would you recommend to the Barcelona area and ecosystem to keep on pushing its ambition in our area, in our sector?
There is this amazing buzz going around in Barcelona at the moment, which very few people actually realize, I'm afraid. So I will be in Barcelona only this year more than 4 times, which is crazy, right? So there's probably 2 ways of looking at it. My wife and any other normal thinking person would say you travel too much. The other one would say actually something's going on there. So there is this massive momentum building. Probably what it's lacking been so far, and I think that's typically a matter of time, is that we need more leadership, more experienced executive teams that can actually build the next generation of biotech and medtech and deep tech companies. I think that's not what we have seen, because the industry has not been that old yet. I think once we get that, science is there, there's amazing scientists, amazing drug developers, there's good investors. We need entrepreneurial teams, and I hope that will be recycled into the industry in the coming years.
Serial entrepreneurs, that's what we need, not looking to anyone. So. And then, Laura, AstraZeneca chose Barcelona to establish the AstraZeneca Barcelona Global Hub. And how have you found talent here? What challenges are you facing, and why you choose Barcelona?
So I echo what my colleague says, and for personal experience, I've been half of my career in Asia and Europe living in abroad, and basically Barcelona is one of those places that is safe. The quality of life is amazing, food is good. You can have your family here with no problem, sea and mountains, so it's a perfect spot to attract from people from the, let's say, personal point of view. So that aspect is checked. As a company, we were partnering with the Generalitat and with the mayor, Colboni. I truly, and here I want to recognize and thank you, because it has been an amazing partnership, what we have been working with him and his team, and we truly believe that this kind of partnership and collaboration make us really create the hub of Barcelona. Today we have 1,600 employees here already living here, 60 nationalities, as Carolina was saying, so fantastic diversity, 60% nearly women. That is an important aspect to reflect. And we are mainly dedicated on R&D, 70% what we are doing, while 30% is, let's say, artificial intelligence. Something important for us, and we discussed with the mayor, with Colboni, was we want to be part of the community, because we think that bringing talent into a country is easier and is better for the company, for the people, and for the city to bring people into the community. So that's why we decide to go with the Estel building instead of going outside into the outside in the outside area of Barcelona. We took Estel building and we are part of the community. So for us that was an important piece, and people working in Estel are extraordinarily happy, so that's fantastic. As my co-partners here were saying, Barcelona brings the perfect ecosystem to bring people, because even if they don't like it, there are so many options after that they can choose, and they are not kind of lost into a city with not different alternatives. So it's a pull effect if you wish. So we have committed 1.3 billion to be delivered up to this 2027. We are truly on time of that, and so far, just a number, last year we have received 16,000 job application for so for all the jobs we have posted. So really happy, and that gives you the sense of how much attractiveness Barcelona and Catalonia brings to the Estel and to AstraZeneca.
Thank you, Laura. Thank you, Carola. Thank you, team. Just to conclude, the opportunities here, we do have the fundamentals to make the biotech and the life sciences ecosystem a truly leader sector in Europe and in Barcelona, and the rest we'll speak later. Thank you. Thank you so much.